Hi guys, and welcome to the world of Beth. Today we are going to be talking about skincare, and specifically we're going to be talking about acne or spot prone skin. Now this is a video I've had a request from one of my subscribers to do because she knows that I've had trouble with my skin in the past, and as you can see now I don't. So, this is just going to talk you through do's and don'ts for having problem skin, common mistakes that you can make, and things you can do to get rid of it. So, first of all, I know you may look at me now, and I'm literally recently out the shower, so I've got no makeup on at all, which I can prove to you by quickly just taking a wet wipe and completely nothing. It's nothing. Okay? This is literally just how my skin is now. Oh, now my face is wet. Okay. So, as we can see, not wearing any makeup, but my skin is clear. Now, if my editing techniques are working correctly, that way, I'm just going to pop a picture here of what my skin looked like about 5.5 years ago. I had cystic acne, so now go away. Don't want to see that anymore. Ugh, still gives me shivers. I had cystic acne, and I had it really bad, as you can see from that picture. Particularly the one that I had on my eye. It was so big and so painful. It actually was difficult to open my eye for about 2 weeks, and it's horrible. Anyone who has ever suffered acne, if you're watching this video now and you have acne, I'm sorry. I know how painful it is. I know how terrible it is to wake up every morning and before you even open your eyes to do this, to check to see if there's another lump or something on your face. I know the anxiety and the depression that comes with it. I know the feeling that everybody is staring at you or staring at your face. And just, I mean, for me it was crippling. It gave me terrible anxiety. I didn't want to leave the house. I used more makeup than is humanly possible, and it still didn't work. And you know, I tried every product out there to get rid of it. I tried cleansers, I tried creams. I at one point took TCP antiseptic and literally just washed my face in it day after day, so my skin was bright red. So I know, I understand how horrible it is. So first of all, if you've got acne, the myth out there is that you have dirty skin, that you don't clean your skin, and that's just absolute rubbish. People who have acne, either in a light or a severe form, probably have the cleanest skin possible, because we are trying everything to get rid of our acne or our spots. So we're cleansing all the time, we're cleaning our face. If we do put makeup on to try and cover what's there if we have to go out, the second we're home from work or the second we're home from going out, if we've had the confidence to go out with our skin that bad, we are washing our face, we're cleansing, we're getting rid of it. Now, this actually can be a problem. You can over clean your skin, and what you're doing when you have acne and you're over cleaning your skin is you're actually pushing the bacteria, because remember, acne is a bacterial infection. It's not just regular spots, it's not a couple of blackheads, it's an infection under your skin. And what you're doing is pushing that infection further and deeper into your pores, so it's actually going to take a lot longer for it to come out. Now, the second piece of advice I'm going to give you is, please, whatever you do, however tempted you are, do not try and squeeze or get rid or scratch at the acne, cysts or spots that you get. I'm really lucky. I did scratch a couple of mine, and if you look very, very closely, and I go, like this. You can see some scarring still here. I've got some discoloration on this part of my skin. You can't see it very well because of the lighting, but I promise you there is some discoloration here from where I had a cluster of acne spots here. I've also got some scarring slightly here and some on my cheeks as well. And that's because I'm terrible at taking my own advice, and sometimes I just got to that point where I couldn't take the pain of the acne cyst anymore, and I desperately tried to squeeze out what is a cyst from a tiny, tiny little pore, and obviously it doesn't work. So I ended up with scars. So please, if you've got acne, put on oven mitts, put on mittens, put on gloves, something. Just don't let yourself scratch or squeeze at your spots. My first piece of advice, if you've got any kind of acne, be it cystic or large whiteheads or blackheads on your skin, is use unscented, unperfumed soap. Just to wash your face in the morning and in the evening, and make sure that you are moisturizing your skin. Moisturizer is not going to contribute to your acne because, as I said, it's a bacterial infection, but what it will do is keep your skin hydrated so that when the spots finally do come through, it's going to be easier for them to be wiped away than if you're not keeping your skin hydrated. My second piece of advice is, as soon as you start seeing an outbreak that is not shifting, and usually acne is quite symmetrical, so you'll get it here at the same time, or you'll get it here. I always used to get one here and here that used to come up at the same time, and it looked like I had 4 eyes. It was horrible. Or I used to get the same 2 come up here. Acne can be quite a symmetrical problem. As soon as you start to notice that kind of pattern, go to visit your doctor. There are a lot better and more well-known treatments for acne, but your doctor may try first of all, especially if you're female, to put you on the contraceptive pill. I don't think there's a doctor out there that will try and put a man on the contraceptive pill, but I'm not a doctor, so I don't know. But they will probably try and tell you, oh, it's cyclical, it's probably something to do with your cycle, again, if you're a woman. So they may try and put you on some kind of contraceptive pill to balance out that. Say no. Say no. Your doctor is there to help you, and obviously they have medical knowledge, but you are also there, and it's your body they're putting these things into. So you have a right to disagree with what they're saying, and literally ask your doctor for a specific thing, and that is either Minocycline or Doxycycline. And both of these are specifically designed to help get rid and clear up acne breakouts, minor acne breakouts, minor to medium. I still take Doxycycline every now and then because even though, as you can see, my skin is clear, as soon as I get a couple of spots, I'm like, right, I'd like a couple of weeks back on the Doxycycline, cut that off before it gets any further. So yeah, they'll give you like a 2 to 3 or 4 week course of either Doxy or Minocycline, and they will see if that clears up your skin. If it's more of a whitehead or a blackhead problem, then that kind of drug, Minocycline, Doxycycline, is most likely going to clear up your acne. I would also recommend asking them to give you a stomach protector, because both Minocycline and Doxycycline can cause the most awful acid reflux, and because of when you have to take them, which is usually morning and evening, the acid reflux you get at night will wake you up, disturb your sleep. It's not pleasant. A stomach protector like omeprazole, I am terrible at pronouncing names, hold on, omeprazole. It's a stomach protector. That will stop that acid reflux straight away. So ask your doctor first for Minocycline or Doxycycline and the stomach protector and see if that works. During this time, while you're taking this drug to try and clear up your skin, I recommend the following things to help loosen your skin, to encourage those spots to come out. Now, because you've started taking a drug to get rid of these, be aware that your skin may look worse before it gets better, because the job of this drug is literally to push out the bacterial infection. So within a week of taking it, you may see the spots get worse, but that's just because all the rubbish under your skin is coming out. So that's actually a good thing. So it's not pleasant, but it's a good thing. So don't be put off by that. What I do suggest to make that process easier is to take something simple like a towel and heat the towel in a microwave, or get yourself a hot water bottle and wrap the towel in the hot water bottle, and then just lay with it like this on your face for about 5 to 10 minutes, and this will open up your pores. So basically, because your pores are open, because they're warm, it will let the things that are under your skin come out more quickly. This is also a good idea at this point. This is when you should be using a very lightweight moisturizer. I do recommend aloe vera for its regenerative properties. It honestly is the best thing that I found, but make sure you're getting quite a nice one and it's a non-greasy formula that's going to soak into your skin right away rather than sit on your skin. And remember, you're just going to clean your face with normal soap and water or normal toner or cleanser. You don't have to spend lots and lots of money on like branded things like Clearasil or Neutrogena Skin Clear, things like that. Plain soap and water, moisturize, warm towel, you're fine. Now, if you get to the end of the first 2 or 3 weeks and you're finding that the acne hasn't gone away, or it hasn't gone away as much as you'd like it to, go back to your doctor after your first course. Now, they may tell you to try another 2 weeks or to try another 3 weeks on Doxycycline, or they may switch you over to Minocycline or vice versa, depending on what you were on. And at this time, I recommend that you do that, because it might just be that Doxycycline didn't work for you and Minocycline will, or Minocycline didn't work for you and Doxycycline will. For example, I take Doxycycline, Minocycline, sorry, the active name, really doesn't do much for me at all, but Doxycycline does keep small breakouts under control for me. So it might just be that you've got the wrong cycline. Now, try that again. Obviously keep going with warm towel on your face every evening, moisturize, that's your routine, and mittens on if you're tempted to scratch or squeeze. Don't do that. If you really want to squeeze them, make an appointment to see a dermatologist who will take them out properly for you, especially any surface ones like big blackheads or big whiteheads. But if you've got cystic acne, do not squeeze them. Just no. Just don't. It's a really bad idea. You will regret it for the rest of your life. Okay, so we're going to jump ahead now 2 weeks, and you've tried your different version of cycline. Go back to your doctor. At this point, you may have to push them a little bit. Some doctors are very good with it, depending on the severity of your acne, and if it's very clear, like the picture of mine was at the beginning, that Doxycycline, Minocycline aren't working, they will refer you to a dermatologist. A dermatologist will take one look at you and will recommend a drug called Accutane, commonly known as Accutane or Roaccutane in some countries. The active ingredient in this drug is something called isotretinoin, and basically it is a massive dose of vitamin D. So before you take it, you will have to have a blood test and a liver function test to make sure that your liver is capable of processing such a high dose of this vitamin, because if you take it and your liver's not capable of taking it, you can get liver failure. So that's a really obviously massively worrying side effect that you don't want to get. So if you are over the age of 18 or 21, depending where you're watching this from, and you think that a potential Accutane test is on its way, stop drinking. Because if you get Accutane, you can't drink anyway. You must not drink alcohol whilst you're on Accutane because of the excess stress to your liver. So stop drinking, it will help with your liver function test. So if your liver function test comes back okay, and they give you Accutane, again, as with the Doxycycline and Minocycline, expect it to get better, to get worse before it gets better. And this can be incredibly depressing because you will spend a month watching these massive cystic acne lumps appear on your face, and it can be so demoralizing because you've gone through this whole process of trying to get rid of this stuff, and you've been told about this wonderful thing by people like me, and then suddenly you find yourself, well, looking like the elephant man of acne, and you want to come on here and leave me a comment saying, you told me it would be better, and it will, but maybe not for the first few weeks, because as I said, it needs to get rid of everything. And isotretinoin or Accutane works by shrinking the pores under the skin to such a tiny scale that it literally can't contain any of that bacteria anymore, and it pushes everything out. So you're really, really cleansing the skin. Now, one of the biggest side effects of Accutane is that it's supposed to dry you out from the inside. It's literally drying up your pores from the inside. So you have to be aware that things like your lips and the inside of your nose are going to be really, really dry. I mean, below your nose and the inside of your nose is going to start bleeding. Your lips are going to be very chapped. Your best friend in this situation is Vaseline Intensive Care Cream. And literally, you will just take a little on your lips to hydrate, and then a little on the inside of your nose. Get it as high up as you can. I'm not going to do that on camera, but use a cotton bud. Just get it on the inside. It doesn't feel very nice, but it will stop your skin from stretching and breaking. Also find yourself some good moisturising eye drops, because your eyes will be exactly the same. And I know this sounds like counterproductive because you're trying to dry out your skin, but you want to stay moisturised as well, because you're trying to dry the skin out from underneath where the bacterial infection is, not on top. So make sure that you're moisturising pretty much head to toe everywhere. Again, I recommend aloe vera, but really up to you. Last of all, drink plenty of water, because you need to stay hydrated when you're taking Accutane. This is a problem because Accutane can make you lose your appetite, and drinking lots of water also makes you lose your appetite. So you must make sure that you're still eating regularly, because otherwise you're going to end up quite unhealthy. And not eating regularly also puts excess strain on your liver, which is not going to help the Accutane work. The amount of Accutane you take will be calculated by several factors: your age, your height, your weight, your gender, and usually most people are put on a 6-month course. You will start to see benefits after about 3 months, but don't stop taking the pills. Even though you hate the side effects, you do need to take the full course to make sure it doesn't come back. There is one other big factor with Accutane, and it's one of the things that you will see if you Google it, is the suicide risk. It is a very, very rare side effect that some people who have started taking Accutane have suddenly become depressed and then killed themselves. And their obviously grieving family members have blamed the Accutane. Now, I can say from experience myself, acne gave me depression. acne gave me anxiety, and when at first I took the Accutane and it seemed to make my skin even worse, that depression and that anxiety intensified. Now, I never had suicidal thoughts at any point while taking it, but depending on the severity of your depression or anxiety over your skin before you take it, do be aware that can happen, but it's like a tiny little fraction amount, and as long as you've got good support around you, I don't think that's a major factor, and I certainly don't think it should stop you from trying this honestly wonder drug. I mean, again, I'll put the video wrong way, always the wrong way. I'll put the picture here of what my skin looked like then to what it looks like now, and you've got to take that chance. Now, just for general skincare while you've got acne, again, gently wash your skin with a gentle soap, something unscented like Dove, warm water, face towel that's warm, and then moisturize. Do not over cleanse, do not push that bacteria down, do not squeeze the spots at all. If you do not want to go down the route of medical intervention for acne, which I don't suggest, I do suggest the medical option, but if you're one of those people who doesn't want to do that, you are going to have to live with the fact that cystic acne is never going to go away. Any herbal remedy you take for it may smooth your skin on the surface, but you are still going to get lumps under your skin because it's an infection. And no amount of, clay or drying out or tea tree oil is going to change the fact you've got a bacterial infection under your skin. So medication really is the only way forward. However, if you do want to take some herbal supplements, tea tree oil is fantastic. Dab it on your skin. It will dry out spots that are like whiteheads that come up. Another thing that I can really recommend is the Acne Patches. Have a look on Amazon. There are hundreds of them. I can't see, no, I should have got them in advance, I'm sorry. I use one by a company called Briley, and you just literally stick them where you get a spot come up, one or two on your face. They're transparent, but I don't wear them during the day, I wear them overnight, and in the morning the spot is visibly reduced in size. So these are just basically tea tree oil patches, and it will help dry out the spot and bring it to the surface so it goes faster. Another thing you can also try is taking over-the-counter ibuprofen, because this will help reduce inflammation in your face. And for redness, there is nothing better if you are just going for cover-up than colour-correcting green primer. It literally, I mean, this is called Miracle Prep, and it's by Max Factor, and it really does. It is miraculous. You put a little green over the top of where you've got any redness, and it will just change the colour of your skin. So yeah, if you're suffering from acne, or you're suffering from any type of bad skin and you want to do something about it, my first, biggest and most important piece of advice: visit your GP, visit your family doctor, and put your foot down. Be specific. Ask for medication, Doxycycline, Minocycline, and if that doesn't work for you, ask for a referral to a dermatologist who can prescribe you Accutane. I will leave in the description box a list of the different medications to use, a list of basically how to wash your face, and really all else I want to say is, if you're going through what I went through, leave a comment. I will support you through this horrible time in your life, because I've been there and I know exactly how difficult it is. I had to go through it on my own because I was travelling at the time around the world, and I was literally all alone when I went through it, and it was one of the worst things. So I don't want any of you to feel alone if it's that bad. Leave me a comment, let me know how you're getting on. If you need support, I will be here for you. And that's really all I have to say for looking after spot prone skin just take care of your skin, don't overwash it, use a light moisturiser, no squeezing. The teacher in me coming out now, no squeezing. Really bad. The scars will last a lifetime. It's not worth the satisfaction of that one pop, I swear. Visit your GP, be firm with them about what you want, and good luck. I really hope that whatever method you choose works for you and that your skin clears up. And I will just leave you with one thing. If you use Accutane, it shrinks your pores. So this is probably one of the reasons why I'm 40 years old and I don't have any visible pores, and I have very few fine lines and wrinkles. And that is thanks to the work the Accutane did underneath my skin. So there are long-term benefits to it too. So again, if you're going through it, please do leave a comment. I'm happy to support you through your acne journey, and take care until next time.